My name is Tricia Parker, and I am the division's Health and Wellness Coordinator. Assisting me today with this presentation is Leslie DeGroat. Leslie is the Clinical Coordinator Lead for the division. Leslie and I are representing the Clinical Operations team. The intent of today's webinar is to discuss identified common struggles with completing the HRST screening, the Health Risk Screening tool. Today's webinar focuses on screening and getting stuck in disagreement status that prevents raters and reviewers from moving to the next stage of the health risk screening tool process. At the end of this presentation, if time permitted, we will have a Q&A session. We will be monitoring the chat, so please drop any questions in the chat at any time during the presentation. We will address those chat questions during the Q&A session. Today's webinar is only an hour long, so if we don't get to all the questions, we will post a Q&A document with the recorded webinar on the division's webpage. At the conclusion of this webinar, there will be a short survey, and we will encourage you to complete the survey so the clinical operations team can provide continued support as we move through the HRST process. So we'll move on to the next slide. Today's topics. Again, thank you for joining today. Today's webinar is intended for current raters and current reviewers. The clinical operations team has identified areas within the HRST process where raters and reviewers are struggling. The focus areas will be getting stuck in the disagreement status of the rating and timely completion of the health risk support plans. The topics today will cover phase 1, which is where we are currently at with implementation of HRST. We will review the HRST process document, and the highlight there will be timelines, steps in the process, and the health risk support plans. Our final topic of discussion will be resources available to both rater and reviewer, and any upcoming lines of efforts and training development. Next slide, please. So HRST implementation, currently we are in phase 1 with implementation. Phase 1 allows for providers to come on board voluntarily. Phase 1 also allows for data analysis and provider feedback to determine any changes or enhancements that may be needed going forward. Projected timeline for statewide implementation, phase 2 is May 2023. By May of 2024, all individuals receiving waiver services should have at least one HRST screening completed. Next slide, please. Okay, so the health risk screening tool process document. The health risk screening tool is a tool used to provide early detection of health risk and destabilization. The Missouri Health Risk Screening Tool Project has also designed standardized electronic health risk support plan templates in the inelectability system, which will support the team with identification of implementation strategies to mitigate risk and improve health outcomes. The completion of the health risk screening tool and any applicable health risk support plans will align with the individual's annual individualized support plan meeting, the ISP meeting. There is a link on this slide for the health risk process document overview. Next slide, please. Okay, sorry, I had to, I lost my place in my notes. Okay, so screening and rating. My screen just went blank. I apologize, guys. Okay, so this slide describes who gets screened and when. The health risk support, the HRST is updated at least annually as a component of the ISP review process. So at least annually at the time of the ISP planning month and before the ISP implementation date, The process also requires that the HRST be updated throughout the ISP year when changes in status are identified that may change any of the 22 HRST rating item scores. When changes in health status are identified, the assigned rater within 7 business days will update the applicable HRST rating items for which the change in health status applies. Examples include but are not limited to hospitalizations, emergency room critical care visits, behavioral changes or unusual changes in routine, communication by the person of changes in how they feel, any event thought to signal a health event, and injuries. I do want to note that medications and diagnoses are to be updated within the HRST system at least annually, at least monthly, or at time of discovery. This includes short-term medications such as antibiotics. Remember that ongoing monitoring and planning are key components of health risk mitigation and health stabilization, and it's the responsibility of the assigned rater to ensure compliance as it relates to updating the HRST for the annual update or as needed due to health or behavioral related changes. Next slide, please. Clinical review. This slide describes the clinical review process after a screening has been completed by the rater. It describes who completes the clinical review, the purpose of the clinical review, criteria for a clinical review, and designated timelines for the clinical reviewer. It is important that the rater understands the role of the clinical reviewer and vice versa. The clinical review is completed by the assigned regional office RN when the individual has a healthcare level of 3 or higher and is to be completed within 14 business days of an initial screening or rescreening or update. The clinical reviewer's role is to evaluate validity of the screening and associated healthcare level. It is a component of quality monitoring. The clinical reviewer is also charged with quality checks on those screenings with the healthcare level of 0 to 2. The clinical reviewer will be conducting quality monitoring reviews randomly for those individuals with a healthcare level below 3. So this is a fundamental basic clinical review. When the individual has a healthcare level of 4 or higher, or throughout the ISP, the individual has an increase from their previous healthcare level of 3 or higher by 1 healthcare level, then in addition to doing the base quality monitoring review, the clinical reviewer will complete an expanded clinical review. This is the review where they will be looking at other monitoring systems and documentation such as the event reporting management system, EMT2, medical claims data, RN monthly health summaries, etc. However, if the screening is not in agreement status and the associated health risk support plans are not completed, then this prevents the clinical reviewer from completing the expanded clinical review. Health risk support plans and that process will be described on the next slide. Okay, so this slide, health risk support plans, this slide describes the purpose, criteria for completing a health risk support plan and the timeline for completion. The health risk support plans are utilized by the rater to direct their monthly nursing oversight to improve overall health outcomes and mitigate health risks for the individual. The completed health risk support plan will serve as an attached component of the healthy living section of the ISP and are to be utilized as an educational resource for interdisciplinary team members, providing direct supports and services to the individual. The health risk support plan templates have been designed to align with the 5 categories of the health risk screening tool. Plans are to be completed for any rating category with a rating item under those categories that have a score of 3 or higher. Health risk support plans are to be completed once the screening has reached fully rated status. Fully rated status is reached when the health risk support, the HRST is completed by the team for healthcare levels of 0 through 2, and or once the HRST clinical reviewer has reviewed and agrees with the completed screen for those that meet the criteria for a clinical review. As a reminder, that HRST and health risk support plans will need to be completed by the ISP implementation date, because the health risk support plans will be attached to the ISP as a component of the healthy living section. Next slide, please. So getting stuck in disagreement status. Through data analysis, we have discovered that ratings are often getting stuck in disagreement status for extended periods of time. This prevents the rater from completing the next step of the HRST process, which is the HRSPs. The role of the clinical reviewer is to evaluate the validity of the screening and associated healthcare level. It is a component of quality monitoring. When completing the rating, please keep in mind that you should be providing enough detail to support the rating item. If the clinical reviewer can't make a reasonable conclusion that the rating item is correct, then they have the responsibility to ask for clarification or additional information. This is known as a disagreement. It is not a statement to say that they know more or have more information about the individual than the rater. It is a statement saying that the rater has not provided enough information where the reviewer can agree with the rating. Throughout this process and through talking with those providers that have been onboarding in phase 1, it has been verbalized by raters that they don't understand the disagreement, since the raters know the person the best. This is a true statement, but it is also the supporting argument for why a reviewer may not be able to confirm that the rating item is correct. So when completing a rating, please complete with the idea that the reviewer does not know the individual like you, and provide comments to each rating item that paints a picture and supports your rating score. Next slide, please. When looking at the data with our partners from Ineluctabilities, we identified items that were frequently noted to have disagreements and or errors on the rating and reviewing side. We won't go over each item here specifically because we are just sharing what rating items are troublesome. Later, we will share some resources that are available currently that may be helpful in troubleshooting rating items, whether it's on this list or if you're just really struggling with a rating item. Next slide, please. On this slide, we will talk about some of the common rater discrepancy or errors made when rating that have been identified through our data analysis with our partners from Ineluctabilities. Rating items where a number of episodes, visits, are to be counted. Disagreements happen when we don't include those counts in the comment section or when we provide a range. Comments should provide an easy way for the reviewer to tally those rating items that are based on counts. For example, if a rating item is asking for how many times the person's day was typically interrupted in the past 12 months, you could, in your comment, note something like primary care visit ×4, neurology ×2, ER visit ×2, diabetic foot care ×12, etc. You could also provide dates, and the reviewer could tally based off the dates provided. However, unless specifically asked for in the scoring definition, then it is not necessary to provide dates. Simply try to categorize or bucket and provide a count for the past 12 months. Another common error raters make when scoring that has been identified is that emergency visits do not only include ER visits. Emergency visits include those medical evaluations or consults for an acute illness in settings such as ambulatory care clinics, urgent care, walk-in clinics, or going to any of those settings because their healthcare provider was unavailable, or a preference was made by the individual to go to those settings versus the primary care physician's office. And, you know, sometimes, you know, we have individuals that do like to go to the emergency room or to the urgent care over their primary care physician's office because they might like the staff better there or something. There's multiple reasons why that may happen. Finally, understanding the differences between items K and O. Rating item K is related to GI issues and does not include episodes of constipation or diarrhea. This gets confusing when we talk about fecal impactions or bowel obstructions, which are included in item K. Fecal impaction and bowel obstructions require a more invasive procedure to correct than simple constipation, which would require the person to score a 4 in this rating item and also rating item O and possibly rating item V. This item also requires a history recall for GI bleeds, which and will always have a score of 3, even if no other scoring items apply. Item K scores are asking for counts, so comments should describe the type of GI symptom and account for item K. Item O is related to constipation and diarrhea, bowel elimination. Again, the person will score a 4 in item O as well. For any hospitalizations related to bowel obstruction, fecal impaction, bowel resection, paralytic ileus, or history of. It is important to note that medications in item K and O differ as well. Medications used to control constipation in item O are not considered in item K. Next slide, please. So reviewer considerations. It would not be fair to discuss common rater errors without talking about common reviewer errors that lead to unnecessary disagreements or incorrect healthcare level assignment. Many disagreements happen when reviewers want more information than what the rating note provides and what is indicated to accurately determine if the score is correct. Through data analysis with our partners from Inelectability, it was discovered that reviewers are often disagreeing with an item to ask the rater a question that will not change the score. An example would be asking the rater to document the outcome of a medical visit or ask for a date of a medical visit, but the score is not dependent on either. Another common theme noted is reviewers are disagreeing to ask the rater to list the medications in the comment even when the medications are listed in the medications tab and the score is correct according to the rating note count. On the flip side, data analysis also discovered that reviewers are agreeing with a rating item where the comment does not support the score. An example here would be rater notes. For the rater would make a note for a range when we're needing a count, say like 45 to 70, but the rating item is actually asking for an actual count. Next slide, please. Okay, so this last slide here is about resources. Now that we've highlighted some areas where both raters and reviewers can improve the process flow between rating and reviewing, I would like to provide some resources that may be helpful when we are getting stuck. All of the resources listed on the slide can be found on the HRST platform, either in the Knowledge Base Library under the Help tab, or your training library, which is the graduation cap located at the top right-hand corner of the screen. And Leslie, do you have that pulled up?
Can you guys see that okay?
Yeah, so that is the website for HRST. And what I was wanting you to do, there you go. Okay. So Leslie has entered the demo site for HRC. The graduation cap is there on the top right-hand corner. And that is your training library. And then under the help tab, and as you can see, she's scrolling through, there is, your assigned courses, and then below your assigned courses will be the ones that you have completed. And you can go back and review those at any time. And we're actually going to revisit this screen here in just a second. Okay, and then, so that's the graduation cap. And then if, Leslie, if you'll go under the help tab, and then if you scroll down to the third one, the view knowledge base, that's the knowledge base library where there's documents that you can search for, the HRST, and then they have popular articles there. So that's how you get to some of those documents that are available to you. You've got the HRST expanded scoring descriptors, which we'll talk about in just a second. Okay, so thank you, Leslie, for pulling that up on screen. The HRST process document, there's the expanded scoring descriptors. And so the process document, which is on the located on the HRST webpage, that's rich with information. It provides the health risk screening tool purpose description, the why, the role description for all parties involved in the process flow, and timelines. Timelines are important not just on a compliance level or a process flow level, but are also important for to risk mitigation and destabilization of the individual. And so, although all the resources listed on this slide are helpful, the next two are the best resources for rating and reviewing considerations. And she's still scrolling through the process document. And so stay right there, Leslie. So there are tools you have available in addition to the training that you have already received. And you can review, like I said, those trainings that you've already completed at any time. The expanded scoring descriptors that Leslie had pulled up earlier, and I think she'll pull it up here again. There we go. This is a document that expands on the HRST scoring items explanation, and you can see it breaks it down into each one of those rating items. So category 1, functional status, that's the rating category, and then it has those rating items under each category. And these expanded scoring descriptors are really what we recommend when you're doing the rating and doing the reviewing, that you have that available. But there is a trick that I learned just recently. When you're in, and can I have you go back to the demo page real quick? So if you forget to pull this up or you don't have this readily available, can you go ahead and go into your Miss Risk person served? Yeah. And so I'm going to have Leslie, this is a fictitious person. I'm going to go ahead and have Leslie, if you pull up Miss Risk and then go to ratings. Okay. All right. So in the blue box, if you click on the blue box anywhere in the blue box, the expanded scoring descriptors for that rating area will actually pull up in case you don't have it readily available. And that way you don't have to keep switching back and forth, or you don't have to print anything else out. Also, the stuff that's highlighted has further information as well. Perfect. Thank you. Okay, so that was that should help you guide your scoring process and help shape your comments and what you should include in your comments. Now, previously on slide 9, a list of rating items where raters and reviewers were commonly struggling was provided. In your training library, and I'm going to have Leslie go to the training library, the graduation cap at the top. There you go. In your training library, there is a the title, the thing that we're looking for here is the online rater training. There is also one titled MODD HRST rater training. That's available to you for review at any time, but the online rater training is the one I want to talk about for when a rater or reviewer is struggling with a particular rating item. And if do you have the modules there? Yeah, there you go. Okay, so this one, I really like this one because it does break down each of those 22 rating items. If you notice, you've got a module here, and most of them are about a minute, at least a minute long. The longest one I think is item Q, which is 8 minutes. But they're a video module that follows a certain path, and it's something that you can refer to when you're kind of struggling with a rating item or a disagreement, and you can go back and review and see if there's anything that you're missing. And each one of these modules for these 22 rating items follows the same kind of learning pathway. Each model describes what the rating item is, the importance of the rating item. It also depicts the scoring explanation box related to the item, discusses troubleshooting for each rating item, and my personal favorite, how to add comments for each rating item. So this describes things that should be included in each rating item comment so the reviewer can essentially agree with the rating item score. And like I said, they're not very lengthy. The lengthiest one was about, 8 minutes, and that was item Q, I think. So although these are wonderful tools for the rater to utilize when rating, reviewers are strongly encouraged to use these tools when reviewing and providing feedback on disagreements. Another resource that I'd like to talk about is it's called A Missouri Rater's Guide to Responding to Clinical Reviews. It's approximately about a 6-minute video describing the process for responding to a clinical review. This is specific to raters. So when you're in that disagreement status, you may want to check this out as well. There's also, and like I said, that's a 6-minute video. The HRST rating checklist, it's a simple document. I believe you can find that in yep, there it is. You may want to utilize that in preparation for completing the screening. This is specific to raters and won't be utilized by the clinical reviewers. There is also the protocol for completing. Oh, and she's just showing the document, so I'll give her time to catch up. There's also the protocol for completing a clinical review of the health risk screening tool. It describes the clinical review process and provides some helpful tips for troubleshooting medication purposes that may affect the score. This is a good document for both the rater and the reviewer to review for perspective. And finally, the last resource I want to share today is, and let's see if I can't drop this in chat, is the clinical assist through the HRST platform. That real quick. And this is, you can utilize this. This is a support for both raters and reviewers when they need to troubleshoot or ask for assistance or clarification regarding rating items, scoring, medications, etc. We really do encourage that clinical assistant reaching out to the clinical assist within the platform. Their usual time turnaround is, I've heard great things about, it's within 24 to 48 hours that they respond. And what Leslie has on the screen right now is the health risk screening tool process. Okay, next slide, please. Okay, so So those are the things that are available to you now, but I did want to discuss some upcoming training opportunities. The clinical operations team is intent to provide continued support to raters and reviewers throughout the HRST process. In working with our partners within electability, we have an in-app training modules are being developed that will cover what we discussed here today, but will be a more in-depth focused with the identified rating items that were previously mentioned in this presentation. It will discuss the scoring descriptors for those identified rating items, common rating and reviewing errors, and will include a periodic review, knowledge-based checks of information presented. So be looking for that. Like I said, it is in development currently, and we felt that this presentation, this webinar, was needed while we were waiting on the in-app training module production. Okay, and so today we talked about getting stuck in the rating and reviewing process. We would also like feedback on other webinars you would like to have regarding other areas of the HRST process. So be thinking about that. And you can reach out through the MODD HRST project mailbox, and I'll have Leslie drop that in chat in a minute for future webinars that you would like support with, other areas of support. It could be the HRSPs, the training considerations, the service considerations, responding to action plans, your monthly health summaries, expanded clinical reviews for the reviewers. So just be thinking about that. And so I think at this time, we have time to open it up for discussions and questions. Like I said, we will attempt to answer all questions, but if we cannot, we can provide a Q&A document with the posting of this webinar for review. And then I believe that this webinar will be available for review on our DMH HRST webpage, and Leslie can show us where that's located at and drop the link in chat if you would. And so they'll know where to find it. So I will go ahead. Oh, Leslie's gonna take us to the DMH webpage. Okay, and she's going to copy the link and she's going to put it in chat. So this is our HRST webpage. And then the MODD HRST project at dmh.mo.gov. That's where you can reach out, and if there's any other webinars you would like for us to have as support for you in the HRST process, just let us know there. And then on this, I love this. This has really just expanded, and I love it. This is the main web page, and it has these ribbons, and we've got overview. There's some FAQs. You may want to check those out. The overview is where you'd find the HRST process document. And then the FAQs, that's an interesting read. And that's from previous webinars that we've held. Information for individuals and families, information for the residential service provider agency. And each one of these has recorded webinars that we've had in the past. And so you could go out there and view those. And again, this webinar will be posted on this ribbon or on this web page at a later date. Okay, so I will.
Trisha and Leslie, just in case someone's not able to copy and paste or use the link that you had posted, can you please show them how to get to that information from the main Division DD front page?
Yes. Okay, so you'll go to dmh.mo.gov, and you'll click on Developmental Disabilities tab, and then you'll see the COVID-19 banner. There we go. There we go. Developmental Disabilities, COVID-19 banner. And then you'll scroll down and under Quality Programs. At the bottom right, you'll see the health risk screening tool process. And if you click on that, that'll take you to the HRST webpage.
I apologize. I was trying to speak on mute.
Oh, that's okay.
But yeah,
We all do it. We all do it.
it happens.
Okay, so we have a few things in chat that I'll go over and hopefully we'll be able to answer. At the end of the webinar, will there be, where will the questionnaire be viewed? The questionnaire, and Barb, you can come off of mute. The questionnaire for future webinars or the Q&A for this webinar?
The Q&A for this webinar will be posted. Actually, I'll just go ahead and start kind of trying to answer it. It will be posted under webinars on our DMHDD webinar page, and I can show you where that is. But we will also have a link. We will have it linked up to this page, the Mo Health Risk Screening Tool project page. And I can show you also how to get to recorded webinars if that is okay, while we look through other questions. Let me
That'd be
share my
great.
screen. So I'm on you can just go to the DD website. If you go to the director's office down here, click on that. And like just about any of them that you click on, when you get to a certain page, there's our director, and you can go down to webinars here. And here is this one right here. This is the registration link. Now, after a bit, when everything's all organized and such, and the recording has been, reviewed and completed and different things of that nature, it will be posted on the webinar page. So, and if there's any other kind of webinars that you'd like to see, they are on this webpage. So just kind of scroll through. Some of these haven't even occurred yet. So you can always go to previous webinars and it will show the different ones that we've had. And like I said, once those are ready, it will show up down here. Sometimes it may take a couple weeks for it to show up. I'm going to go back. Look at other chat questions. Let's see.
So we do have a
Oh,
question from Tiffany Robinson. She asked, medication monthly updates are only for residential, correct? So the idea is that the medications be updated at the time of discovery. So I don't think it's dependent on whether it's residential or if it's, support coordination that will do the health risk screening tool for non-residential folks. But it's at time of discovery. That's the, at bare minimum, that's when we should be updating the HRS, the medications. And so in your RN oversight, you're supposed to be reviewing those medications monthly. So, you could say, yes, monthly, they need to be updated, but also at the time of discovery.
Yeah, so I think there might be some support coordinators on the call and so that would, I mean, if you're visiting with them, checking in with them quarterly, and that may be the only time you would ever even know about any kind of change. So yeah, that's when you would update it.
And so then Alyssa had asked if, does this include station MD visits? And I'm thinking that's back to the questions about the emergency room visits. Are you, and I guess you can't unmute. And Alyssa, if you could drop in chat, just saying if that's where you were coming from with that question.
But those also would, those would count however you would consider like doctor's visits or things of that nature, and factoring into just the different rating items that may factor into, you would count station MD.
Yes, you would
however it
count
would
state,
affect
yeah,
it.
in the doctor visits.
And then another question, how do you get to the training for the training module that you are showing? Your agency will need to go on the website, and you can always reach out to our mailbox. No problem whatsoever there, but you'll go to that. And if you're a residential provider agency, you would want to watch the webinar and get an overview of it, review these documents, review the Q&A. Right here is a link and it says survey questions, but what it asks is for your agency's contact and just some different details about your agency so we can make sure that we get you the proper access. And you'll want to select a gatekeeper, which will be in charge of getting people access or removing access or inactivating their access to the MoDD HRST system. And after that, we will review your survey questions and send you a WebEx invite to join a call, and we'll talk through some things, do some questions and answers, and then your gatekeeper will receive an email that will enable them to be able to log in and do a gatekeeper training so they can learn how to add and remove access for the people. And so after they get through that training, they can start adding your staff or personnel whom you want to have the different accesses. And then once they get those email links, they can log in, and then the trainings will appear, and they'll need to, and then each staff person will have assigned trainings depending on what their role is. And they'll need to complete those trainings in order to be able to see their people, that they're supporting. So that's kind of what the process looks like to be able to get in and do those trainings. And it should show up once, if you already have login. Here, I'll go back to if you already are able to log in and have completed the trainings, you'll go to that training cap, and it'll take you to this page right here. And I don't want to freak anybody out. I have a lot of duplications, and I have 2 accounts, so I have like tons of the repetitive, and not everybody's going to have that many trainings, but the RN raters and the support coordinator raters will have the most. Let's see. For individuals residing in their natural homes, SCs do not always get notified of med changes and short-term med additions. How should they navigate this issue? Yeah, just the best that you can. If when you find out about it at your quarterly checks or what have you, enter it in there, because just kind of how it fits in with your current process, with touching base with the individuals. And then how will they be notified if the provider community RN has updated these to be sure the plan is updated? Yeah, the running list of medications and diagnoses in HRST is supposed to be what is considered the point of like the main source for that information moving forward. So you'll have access to that at any time. There might be ways that we could probably hang on just a second. I'm going to see if I can turn on notifications. Under your name, you'll have notifications, and I have where I can click off and look at different things, like if the healthcare level increased. That's something that we could actually probably explore to just see um, about notifications related to those SCs with providing support for residential and knowing when those things are updated. So I can note that. And I'm scrolling through. And in order to just for, there was a question in chat about planning on going live in January. And as long as you allow, we recommend is, allow for, watching the webinar, and reviewing the documents, joining, one of the implementation calls that we have monthly. We have specific ones for specific agencies. We have a residential provider monthly call for implementing when people are at that stage. We have the support coordinators who are wanting to start rating, support coordinators who are just joining because maybe a residential provider is joining. And then we also have a monthly rehabilitation employment services meeting. So, allow for time for that. And then we like to say, allow for about 30 days for people to get their access and get trained up and be able to ask questions prior to rating and screening. So, yeah. So that's kind of what that looks like. So I'm just going to throw this out there too, since people will all need to be expected to start screening people in May once their ISP plan, if that's their ISP planning month. Those people need to be screened. So we're encouraging people to start onboarding no later than, start with getting access and training and all that stuff March 1st, just to make sure that they're prepped and ready to rock and roll. Anyway, great question. Let me look. Oh, and there's also a role, just to let you all know, there is a new role that can be requested, and it is called the rater supporter role. And that is a person designated by your agency who can help input medications, can help input diagnoses. And then the About Me page, I will show you what that looks like. That's a question that was in chat about that role. And thank you for bringing that up. We realize it can be it's a big change in a lot of different for the RN raters, well, and also the support coordinators, but this is kind of to help the RN raters. But here's the About Me page. There's a place where that can have BMI data entered, vital signs. So this rater supporter can enter in information there, as well as in the diagnoses tab and the medications, and go in and update that. And so that would be through the gatekeeper. The gatekeeper would need to request that access. Is there more training for the gatekeepers? Our colleague Misty is working with Inelectability to really hone in on those things that are Missouri specific related to gatekeeper training, because Missouri, we kind of went a little bit further with the different things that we were doing related to health risk screening tool. We're kind of different from other states. And we noticed that there were some things that we were needing to tweak based on feedback from the field. So that is currently under works. And then notifications would help SCs. Okay, cool. Thank you. I will keep that in mind. See, another question. As an oversight RN, my agency has to request access to the trainings for me. I currently do not have anything assigned in my HRST. Okay, I will take your name down. And maybe your agency has not started onboarding yet. Not sure. I'll take your name down though, and look and see what's going on. Let's see. So yeah, if your agency hasn't started onboarding, or if your gatekeeper has not had training, then you likely won't. But if you do find that something doesn't look right, don't hesitate to reach out to the DMH website, or excuse me, email, or the MO support at replacingrisk.com, either one. Okay, and my gatekeeper has not assigned my training to me yet. I do not have the tabs you guys have across the top of my HRST screen. Is that because I have not done the training yet? Well, it'll actually pop the trainings up right away and have you do them. So if you have not, if the gatekeeper hasn't gotten you assigned access in there, then you won't, then you just won't be able to see them. Now I'm wondering, I'll take your name down too, if what you have is, because all oversight RN should have access to be able to get into the oversight RN manual, which is this right here. So all oversight RN should already have this unless they're just brand new. And then so once you get the other access, they will flip your access over to full on HRST, so you'll be able to see all that other stuff. Let's see. Yeah, and then, okay, the question, well, info stated that we had to update the medications monthly. Just wanted to make sure it would not be for non-residential. Yeah, this was actually kind of geared for raters and reviewers, keeping the residential in mind. However, non-residential, whatever's feasible and however it flows, I mean, at least quarterly for support coordinators who are doing the rating, because you're not going to necessarily be touching base with that person monthly. So um, that would be kind of on upon discovery. So you're covered there. Let's see, are there specific gatekeeper training modules? Yes, the person who's deemed gatekeeper, they will send something, or let's see, Misty will send something to, which is our colleague who's our statewide gatekeeper, will send something to inelectability, and they will in turn send it to whomever the designated gatekeeper is for that agency. And then they have a training, and I think I have it, hang on just a second, in here. And it is this right here. It's a 24-minute, 19-second training that they would need to go through and look at. And it talks about what their role is and how to get people, ask for people's access. They're like the go-to person for, requesting the access. Then the whomever they request access for will get an email from inelectability and be able to log in. Okay, and I have another name. I'm going to check on you. Gotcha. And your name does look familiar. I can do that. And I do not have any assigned training yet either. I'm the RN. Okay, I do assume they haven't started onboarding yet. Just got to access first around July. Okay, I'll look at your name too. And I can probably shoot you an email or something. It's okay. All right.
So it does look like Alyssa was asking about the station MD visits and those emergency visits. Does that include the station MD visits?
Oh, gotcha. Okay. And that, unless they are saying go to the emergency room, I don't believe that would just count as, I would say, like probably a doctor's appointment, but of course it would have to be individualized. So kind of depending on the scenario. But if it's just sort of like, so you don't have to wait till the next day to go to the doctor, but they're not really, in need of emergency type, services, then it would just sort of count as like doctor's appointments. But in a specific situation, if you need further clarification, like while you're doing the screening and you're just like, oh, I don't know, you can always reach out for specific questions. Not seeing anything else. Are you seeing anything else, Trisha or Kat? And the people who drop their names in chat who are kind of inquiring, I'll look up your names and if you want to put in, if you're kind of wondering about your status, if you don't mind putting your email in, you can just send it to the panelists or what have you. And then, this is what I recommend. Okay. Mo, Dee Dee, first, project@dmh.mo.gov. So that email, please shoot your questions or anything through that, or to contact Misty and I and our team manage that email. But I'll just say it out loud too. So have your pens handy. It's capital M, capital O, capital D, capital D, capital H, capital R, capital S, capital T, and then a capital P. And then it's like project, ROJECT, and then the @ dmh.mo.gov. So like all together, it's HRST project at dmh.mo.gov. So don't hesitate to reach out through there either. Okay. Oh, okay. And this, okay, one person has the manual. Okay. So yeah, your gatekeeper will need to, yeah, get started and get the training and get you access if when you guys are ready to get going with it. Okay. 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 All right. Well, thank you guys for your questions and your attention. Did anybody have anything else? We have 3 minutes. I'm going to stop sharing. And we want to thank you all definitely for attending this webinar. We hope that it helped, and please look for the recording. And if you have any ideas on any other trainings that you might find valuable to kind of take a deeper dive into some things or help, just don't hesitate to reach out through that email. And you guys have a great week.